Okay, so
So if we had an implant that was deeper, you would have a shallower angle,
okay,
and that angle is what is where I have a problem because we're pushing tissue fairly hard,
okay.
and once again, hard to clean. If cement gets under the steep angle, how are
Yeah.
you going to get it out of there?
Exactly.
Very difficult.
So when you move this abutment over,
Mm-hmm.
you dragged everything with it, right?
Yeah.
All the profile. Yeah.
So here's where it would normally have been, and in this situation, we just move it over a little bit.
Okay.
I can't go quite that far.
So now we know that the abutment's in the right place
Right.
with the embrasures.
So prosthetically, you'll look normal. The question is how you're going to do subgingivally and all of that.
Can we see an occlusal view of that?
Sure.
Okay, so my occlusal hole, my access hole is to the distal regardless, even though we
Right.
have an angle like that.
Well, if you're doing this cement retained, you won't have an access hole. If you're going to do the screw retained, it would be in your interproximal.
Okay.
And then you would
Totally
have
impossible.
you would have a problem with a thin shard of ceramics that would fracture off. You actually would have your screw coming out of your interproximal. Your contact. You wouldn't have a contact on that tooth if you did it screw retained. Your contact would be air. You know, as opposed, or now you could fill it in with composite and make a contact,
Right.
but otherwise you wouldn't have a contact. But as a cement retained, you will.
So deeper emergence profile would have been better on that.
Well, and then the thing about it is that whenever you have an implant that's not in exactly the location you want, if they would drop the implant deeper, it always helps. Whether it's to lingual, to facial, wherever, just go deeper. But
Okay.
then again, you get close to the sinus in this position.
Right.
So there is a limited. Then you end up with a shorter implant. And you're better off not doing that on the
It's a
maxilla.
two-sided sword.
Yeah.
But,
Unfortunately.
all right.
Now,
So it's almost like we're developing a semi-modified ridge lap going to
Right.
the mesial. We're not stretching the distal at all. We're just
Right.
doing a little bit toward the mesial, staying one-dimensional on it.
I want to show you one other thing.
Sure.
With the emergence profile type, we're at linear right now. What I would like to do is freeform, but I can't. I'm going to show you why. If I go to freeform, it adds a dot over here for us to get that S shape. But if you look, it also adds dots on the other side, and it makes it impossible to get the distal. So what I have to do is go back to freeform to linear, remove the dot on the distal, and I'll have to do this manually in the lab when it comes back. So I'll do that little S shape before we make the crown.
Oh, okay.
No big deal. It takes 2 minutes to do.
Oh.
But it's just better than having it distort the distal contours. And if it was deeper, then you would be able to use that freeform because you have more space for those additional shapes over here. You just can't do it on really shallow.
So, Mike, your attention to detail as far as radiuses and line angles, everything must be rolling, soft, S contour.
Yes,
You know, don't give the tissue a chance to harbor any bacteria.
correct.
Okay.
Yeah. We just want to make it go in as passively as possible. So that's generally how we do this. Now over here, I'm trying to match your distal contour from your those pieces that you did intraorally to your emergence profile jig that you put together. So I'm just trying to make sure I match what you did. Right now I think we're violating some of your surfaces a little bit. We don't want to under contour because we don't want the tissue to just collapse, but we also don't want to over contour and push too much, causing your tissue to shape correctly. Now see, this one you could do screw retain on.
That would be great.
Okay.
It's hard to clean cement around molars.
Okay.
It'd be wonderful.
So let's just bring that out a little bit. We'll just add some handles. And we'll go ahead and shape that for screw retain.
So the jig helps. It gets you to a point.
Yeah.
that you can then modify, unlike having just a straight impression coping,
Yeah.
and stay ahead of the game.
And it also helps me know what you're thinking, as far as where the tissue is. If you go chair side and you have really very soft tissue that is very pliable, then you may want to manipulate it a little
Right.
bit. But if I don't know whether this is real tough, tissue type or really loose,
Right.
how much can we push it?
Yeah. Can you see the future prescription pads, maybe including some of that in there with each abutment to give you more of an indication of what we're seeing, or maybe even just a short video, with the placement of the abutment, so you can see how the tissue reacts to the impression copings.
It would be really nice. I wonder if the technology that would make it easier for us to do that. We're starting to get a lot of iPhone images and video and even recordings here and there, but it's pretty rare.
Mm-hmm.
It'd be nice if
Yeah.
the technology makes it easier for that to happen. It'd be great.
Maybe you would suggest that we restorative dentists should possibly carry it not only from our impression copings, but also modify our healing abutments.
That'd
That
be really good.
would some cases we get without any temporary abutments at all in place. We have basically a stock healing abutment, and it gives us the crestal height of the tissue, but it doesn't give us any buccal lingual or added distal mesial dimension.
That would be terrific. A day of surgery, even if the surgeons would had a Stereos used to have an emergence profile healing cap system, but it fell out of favor because you had to have so many different components.
I see.
But there's some new systems out there now. Strauman's got a new system for a tissue level. I mean a healing cap level that's customizable at the day of surgery. Very nice piece. Very nice, and you can create some of those emergence profiles before it even gets to you.
Wonderful.
And you can add to it and change that, and it's still at the tissue height, so you can still get an appliance. That say a patient's wearing a denture or a flipper or something like that, you can still maintain that additional appliance, so you're not making a new temporary.
Fantastic.
So.
All right.